Hello everyone, welcome to Ms. Lambert. I guess everybody had a good weekend. Well, you know what this is. This is Sapphire Financial Training. This class is about motivation session, inspiration, and getting it done. We're not going to talk long. I'm going to give y'all 15 minutes. Just want to touch some bases on you guys. Did you get your index cards? Get your extra books, your extra folders, whatever you need to study. Last week, I did say I was going to start a little bit of E&M, but we're going to do a couple of things, in that, just to kind of give you an introduction. So again, you got people who are not motivating you, keep it moving. You got people who are not on your side, keep it moving. Don't waste your time, keep it moving. If you got something or a goal that you want to do, you can plan all these things in your head and keep planning. But if you don't start implementing, they'll just be sitting there for years and years and years. Take a baby step, that'll lead you to the big steps. So, I don't want you guys to be like, I want, and then you're not, doing anything to get it. I got an email about someone who couldn't work certain hours and they want to do billing. You guys can do billing at home too. So when you put in for your applications, just put remote. You just want to be a remote biller. You want to be at home. But when you do that, make sure that you have two screens and make sure that you have the computer to use, because they will say, do you have two screens at home? So, you got to have that in order to work at home. Because you guys know when you do billing in-house, most offices should have you guys accommodated with two screens. Sometimes you go and you see the supervisors with two screens and then the workers have one. It's just harder for them. But, actuality, you should have two screens. And they're probably going to ask you for two screens. Okay? So, if that's what you want to do, you can do billing at home. You need a little brush up, you need tutoring, come see us. We can give you stuff that you can go over to kind of refresh your memory, medical terminology, some billing, things like that, of that nature. So, just remember that's what we're here for, to get you back on track. This class is about coding. Coding does have billing in it. Coding has medical terminology in it. Just keep that in mind. My general sessions is coding. All the other stuff is included with it. So, don't worry about that. When you guys get my book, look in the back of it. The prices are in there, and, fees, whatever you want to know is in there. This is the book. Okay? This is the book. It's not that big. So, it's enough for you guys to read and retain. There's a lot of stuff in here that could be on your test. So that's what that book is for. That's medical coding and billing. It's a Q&A book. So it's questions and answers in there, and what you may have about billing, what you may have about coding. So, pick up the book or go on my website and you can purchase the book from there. So let's just start off with a little bit of a discussion about E&M. That's evaluation and management. Those are office services. And that billing portion, it starts all the way around from the front end, the back end, the girls taking the copay, the insurance, all that's revenue cycle. Emergency room, people taking your insurance, that's revenue cycle. Starts from the beginning. Those girls are just on Front Street. Okay, so they do have to make sure that they get the right stuff. That's also an evening position too. You can do, patient access rep. You can do that day, night, emergency room. Some of you guys have flexibility that can work any hours, but some don't. That's a position that you can put in for that will get you 3 to 11 or, some type of evening position. Because those girls are 24 hours around the clock. And the billing office, it is not. But with your billing experience, with your billing training, you can get those positions. Once you go in for billing, you don't have to do a billing position. An entry-level position can be registration clerk, unit 4 clerk, whichever one of those. It doesn't have to be billing, as long as you have some knowledge of those things, because they will ask you that. Okay? The evaluation and management, just be precarious of it, because on your test they might ask you to write a chart about how you do the coding with the guidelines chart. Remember that D&G chart that I told you about? That's a guideline chart, 1995, 1997. We're going to talk about that, but a lot of that stuff I talk about in the class. So here I just kind of give you an idea of what we talk about. HBI. Probably next week I'm going to go into detail on that stuff. History of present illness. Stuff like that. I'm going to show you what that looks like. That sheet that we use to actually do the E&M services. You guys can go into the classroom. Email me. I'll give you the code to go in there and see what it looks like. And you guys, there's a couple of things, and then you can test yourself on, just see if you like it. That goes with your E&M coding. Did I mention that I wanted you guys to at least look at macros and VLOOKUP? Go on YouTube and pull that up and look at that thing over and over and see if you can get it. Because sometimes they ask you, do you know macros and VLOOKUP in those Excel applications? I'm looking for the layout that I have for you guys on that full E&M. We mainly focus on those 3 levels, 99212, 99213. 99211 is not really, a registered nurse can do that, but 99214, that's what I try to focus on. So 99213 is the one that we normally use, and that's just for, stuff that's not too invasive. If you're working in a medical office and you only be coding for E&M, then you only master those type of codes. There's more to it than that, of course. There's 7 units that you need to get to as far as that. Let me just see where we're going to start from with that. Matter of fact, I can give you every time I sit here, I don't ever have a book ready. But I did want to show you, tell you that evaluation and management section. When you get your book, your CPC book, you'll see it in there. It's evaluation and management, and then comes the medicine section. I remember I was talking about the medicine section. It's so fascinating because there's so many things in there that I'm pretty sure you want to look at. Evaluation and management section. We're here, a new patient, an outpatient, 99201, 99202, 99203. Those are the main 3 levels, level 1, 2, and 3. And I'm getting that straight from the book, because it's not like you're going to remember everything. Just have your book so you can remember some of these things in here. New versus established patient. This stuff we go with. I'm not going to give you too much away because I want y'all to join the class. So a lot of this is going to be in a test. And some of these little things in here I did put in the book. Critical care. There are exams on this. AAPC has exams on this. They're like $10 and $15. You can get those. We do have exams in the classroom, but I want you to get the full throttle. No, I don't want you to spend $200 or $300 on books, but only when you get ready to take your exam. Okay, so this is what I was talking about as far as coding the E&M cases. You must know the history, RRS, range of symptoms, personal history, social history. That's the kind of stuff we go over in class. But I'll be trying to cut this to 15 minutes, so I don't want to do too much with this. I'm just looking for a section to give you that I can just say something real easy about. If you just do E&M coding, you won't do those big, large cases. You will do like outpatient clinic and stuff like that, where they are coding those things, emergency room, ambulatory care, urgent care, where they are, the patients are in and out. And patients are in and out. Um, This is basically the same stuff that I'm telling you. A&M codes are divided into broad categories representing the type and or location of service. We just talked about the urgent care, ambulatory, stuff like that. The three components, history, exam, medical decision making, we talk about that. And then all that's on the test. There is a section with A&M. It is on the test. So, and when you guys do get my book, in the book, I did put the word test by some things that may be on that CPC. Now, I probably didn't put, yes, this will be on the CPC, but I did put a question mark there. And the question mark means this could be, maybe it's not. When you see that in there, I want you to index that. That stuff I want you to remember. Also in A&M services, this is also in the book. When the provider is talking to the patient or the provider is consulting the patient as such and the family is there. And I said the patient is gone, the patient is finished. Sometimes I'm ready to go and the family is still in there. You got to put that in there, okay? Add the family in there because you know A&M is coded by time. A&M is coded by time. The family is still in there, okay? Time is still ticking, okay? I'm not saying it's going to be on a test, but it could be, okay? Somebody asked me that before, so if you're listening, I'm letting you know now. If the family is still in there, the time is still ticking, okay? Determine the level of history, determine the level of exam, determine the level of medical decision making, and select the appropriate E&M. When you guys get the book, all of that is in there on how you do that. Document the chief complaint. You guys know what the chief complaint is. The chief complaint is what's wrong with the patient, why the patient is there. That's the chief complaint. Okay, the chief complaint may not end up being the lastly diagnosis. It may be something else wrong with the patient. Once the doctor actually examines the patient, I'm pretty sure that will change. Let's see what this is. Totaling the history components. All three history elements must support the work level to meet the overall history level requirement. This is on the test. It's on the test in a question. If you get this, if you have 99212, 99213, and you have elements only for 99212, they tell you which one you have to choose. I'm going to read this, see if you can decipher this. All three history elements must support the work level to meet the overall history level requirement. The lowest element within the history component will always determine the overall history. The lowest element. If you've got two that are high and one is low, don't go with the 99214. Go with the 99213. Okay? For example, if the HPI and RRS both support a detailed history. See, that's why I'm saying it's a little bit hard to do it on YouTube because some of you guys don't know what I'm talking about. Some of you do. Some of you that have more experience know about the detailed history. I'm just going to keep reading it. Detailed history level. But the PFSH, patient family social history, that's what that is, supports only an expanded problem focus. I'm going to try to pull it up so I can show you what I'm talking about. Expanded problem focus, history level. The history level will stay at the expanded problem focus level. Let me pull up a guy. I just want to show y'all that. I'm going to show y'all that real quick. Hold on. Let me show you that real quick. Let me see. Even though this is the CPC book, it's in here. This is a 2018 book, but it's all the same. Let me see if I can put that in here. And see, you guys are not going to remember that, but those of you who've done it before, you know what I'm talking about. But I want to see if you guys can see this, how they talking about detailed history. I'm just going to pull any one of them out, but let me just stay in evaluation and management. I don't want to go to observation or anything like that. I just want to stay new patient, established patient. Okay, here, let's just do it from here. This is what they talking about. And you can't see. an expanded problem focused history, an expanded problem focused examination, straightforward medical decision making. It looks like that. You see, you have to have different elements in order to know which one of these to pick. Here's one down here. This one we're talking about the problem focused history. 99213. It says office or other outpatient visit for the evaluation and management of an established patient, which requires at least two of these three components: an expanded problem focused history, an expanded problem focused examination, medical decision making of low complexity. That's a 99213. Give me 21211. 99212, office or other outpatient visit for the evaluation and management of an established patient, which require at least two of these three components: a problem-focused history, a problem-focused examination, straightforward medical decision making. You cannot see that, but what some of you guys that's going to start from the beginning, you'll more understand what that is and what pretty much what we're talking about, because you're going to have to do some on your own. I'm going to give you something to do on your own when you go into the classes. You'll see that. They got an example in here. A level 5 new patient, level 4 new patient visit, 99204. That's a level 4. Requires a comprehensive history to meet the comprehensive history work. A complete PFSH must be documented. When they say, let me see. Oh, maybe you can see this. When they say comprehensive history, remember those DG guidelines? They'll have a list. They'll have a list of stuff on there that you can choose. Like the doctor has a check off with what he did to the patient. Let's say the HPI. The HPI, location, severity, timing, modifying factors, quality, duration, context. You guys remember this. You guys, MIB achievers, you guys remember this in classroom? You know Miss Lambert used to stay on this stuff. This is the same thing. I'm just re-guiding. I cannot do the whole thing on YouTube. I'm already in 17 minutes. That's why I be trying to skip over. But I have to pull the book out to exactly show you what I'm talking about. The ROS, right? The range of systems. GI, integumentary. This is telling you how many, systems that the provider look at. That's what they're talking about. That's the only way that you can do it. That's where the DG comes in. Remember we talked about before, the 95 and the 97? You guys are going to have fun with this. I'm telling you, I can't go into the whole thing, but that's a little bit about A&M. And problem focus, limited examination of affected body area or organ system. That is a limited exam on only one affected body area or organ system. That's a problem focused. Patient is cut right here. The provider is focusing on this. He's not looking at this and this and that. That's a problem focused. That's a problem focused. Expanded problem focused. This is the provider looking at the patient. Limited examination of the affected body area or organ system and other systematic or related organ systems. That is a limited exam of at least two body areas of the organ system. Remember that word, adnexa, connecting. Expanded problem focus. It says limited examination of the affected body area or organ system and other systematic related system. If I'm sneezing, baby comes in with a cold, child comes in with a cold. If I'm sneezing, the doctor he wants to know why I am sneezing. What goes with sneezing? Coughing. So if he's checking out your temperature, you've got a headache, you've got a high temperature, and you're coughing and you're sneezing, he's checking that out. That's all together. That's expanded problem focus. So he's doing a little bit more. Let me see if her throat hurts. Check this. Let me see if she has a temperature. Let's see if, her blood pressure up. Stuff like that. So he can really check out and see if we got the flu. Okay? That's expanded problem focus. So he's not looking at one thing. He's looking at something that could be connecting. You see what I'm saying? I see y'all just typing stuff away. And you know what? I'm going to start answering these things that y'all are typing. But I can't answer these things and I'm trying to hit this at the same time. I'm trying to figure out a way to handle that, because some of you guys that are like live are like, Miss Lambert, you're not talking back. I gotta look at this first. So let me just go. Let me show you what the detail is. Detail. Now remember, the doctor's still looking at. I don't have all that stuff in front of me, because I'm not gonna go through all this. We do this in the sessions, but I'll do it. I'm reading straight for the book, so y'all can get your books and just read from your books X, Y, Z. Detail. We're still talking about E&M. Remember, the 1995 and the 1997 DGs defined the 4 levels of exam: problem focus, expanded problem focus, detailed, and comprehensive. Differently, the 1995 guidelines define the levels of examination as follows. This is what they're going by. Remember, 1995 and 1997. The 1997 is just a little bit more detailed. I got a copy of that. I should have had that. You know what? Because I was not planning on doing this. If y'all want to see that, let me know, because I can shoot that to y'all. Even though y'all can go on and get one free. Go on there, go online, go on CMS and tell them let you see 1997 DG guidelines. Okay, so which one was we doing? Detailed, extended examination of the affected body areas and other systematic or related organ systems. That is an extended examination of at least 2 body areas or organ systems. So same thing. When they say 2, they mean 2 body systems. Looking at the heart, looking at lungs, 2 body systems, and it is more detailed. Let me see. I wish I had an example up here. I don't have one, but just pay attention to that. I'm gonna read it again. Detailed examination, extended examination. Now this is doing more than expanded problem focused. He's doing more. Okay, at least 2 body systems. Somebody give me 2 body systems. Oh, okay. So you guys can't like talk back, but just type it in. All right. So let's just move on. Comprehensive. That's more. The doctor's doing more. Some of them just spend time with you, just do more and more. And remember, this is time. Problem focus is this much time. Expanded, you need a little more. Detailed, you need more. Comprehensive, you need more. Okay, general multi-system examination, right? General multi-system examination. He might have looked at the eyes. He might have looked at the skin. He might have looked at your respiratory, ENT, your eyes, ears, and throat. That's what they talk about the body systems. 2 different body systems. Remember the first one, he was only looking at one. So check it out. Those of you who are achievers. When I say achievers, MIB, you know what I'm talking about. Okay? So y'all get your books. You get your books and hopefully y'all still got some of your notes and let it get back to you. Get back into the swing. Okay? Some of y'all E&M was y'all favorite section. So y'all gotta get back to that. Get back to that. All right? So I'm not going to go to too much detail, even though y'all know I'm dying to go into the treatment options, right? I'm not going to do it, but that's a little bit of touchiness on evaluation and management, okay? Because, when I open up that career center, I'll let y'all know where it is. Because, see, the career center it will give me more expansion. I'm trying to do the career center with at least 25 students at a time. Okay, so we're working on that. But if you guys go ahead into sessions, and you guys will get more explanation of how the E&M services go. But basically, I'm just letting you know what's on the test. What you should be studying. You know what I'm saying? They're going to ask you, what those elements are. You know what I'm saying? What are those levels? What are those 5 levels? How long, the provider spending with the patient, What is ROS? I'm telling you, that's one of the questions. What is ROS? Okay, range of systems. You better know. Okay, so again, get the book. Some of y'all don't have time to be sitting in the class or whatever for a long time. But basically, you're gonna go get the information, post to me what I want. Let me see how you retain the information, and let's see if you can remember what you have learned. Okay. So, and also, some of you guys who do want to get the books from AAPC when it's time, or you might get them before, they have some type of payment plan. What was the name of it? It's a payment plan for the books where you pay maybe $100 and then you kind of make payments on it. So that's an idea too. But I mean, you're talking about $900. So just get them. I would just get them one at a time. But I thought I would throw that out there. It's called Affirmity or something like that. Okay. So you guys still need to get those books. Okay. Uh, I was watching something on Bosch the other day, and they had something I wanted y'all to talk about. Oh, I wanted to talk about where the patient did not wake up. The patient was uh, the patient was under general anesthesia, and she was literally waking up, and it was very scary. So some of those things, you might have the code. You never know. And I saw something else on TV. IBD and IBS, that is on your test, maybe. So, what is IBD? Irritable, I can't even say it. Irritable bowel disease. That's a disease. Okay? IBS is irritable bowel syndrome. That's like cramps in your stomach. You have constipation. You just have an unpleasant feeling in your stomach, and it's just change your diet or something like that. It's just you'll be constipated all the time. Your stomach may be hard or something like that. It's not something that's invasive that you're going to get like sores or something like that. Now, IBD, that's a disease. That's like Crohn's disease. Yes, that's like an inflammatory disease. You will have issues with that. That is in your digestive system. Sometimes, what did I write down here? You have abdominal pain. You have diarrhea. Inflammatory bowel disease. This causes swelling, sores in the lining of your digestive tract. Okay, very painful. Very painful. It's very invasive. It's nothing like IBS. The symptoms of IBS too has abdominal pain, a little bloating, diarrhea, not constant, but they do have constipation. Recommended a high fiber diet. This does not cause ulcers and lesions. IBD, yeah, that causes that up in your digestive system. So just be careful with that. Okay. The IBS, it involves your colon. So I would take a laxative every now and then if you feel maybe the doctor's going to prescribe something to you, but take some fiber or something like that. You might have nausea, gas, or feel like you need to go to the bathroom, stuff like that. So be precarious to that one. That one, I know I say that a lot. Why? I don't know. So just watch that one because it sounds the same. You see, IBD and IBS. Just watch that one. There's a word that we was talking about today, and the word is cadaver. Cadaver skin. Cadaver. Anybody know what that is? Cadaver skin. That skin that's harvested from a patient who has passed on. That skin has to be removed while that patient's blood is still warm. So that cadaver skin can be placed on a patient's face, arm, hands, leg. It's like a skin graft, okay? It's called cadaver skin. And a question might be on it, what is cadaver skin? There's a lot to that. Though when we go to integumentary, there's different ones that we're going to talk about as far as skin grafts, auto skin grafts, skin grafts from pigs, different things like that. Okay. See, I'm 28 minutes in. I don't know how the time be going so fast, but just watch those things. Let me see what we got. Let me see what's in here. I remember we were going to talk about PAD. We're still going to talk about PAD, peripheral artery disease. When I do that session, I'm just going to do a session on that because I have people that don't really. I'm not a physician, I'm not a provider, but some people do want to know about some of these diseases and why or how you get them or XYZ. Sometimes people say well, I'm not trying to get no stent. Just give me the blood thinner. I'll take the Coumadin. All right, you won't be going in there. I wouldn't want to go to the doctor 3-4 times a week. I no disrespect whoever does it, that's fine. But to me, I think the stent is a little bit more. Just get the stent and be through. Don't listen to me. I'm just reading whatever I wrote. But PAD, we're gonna talk about that and stuff like that. So gout and all that stuff is kind of related to stuff like that. So just when your circulation start going down, you start getting weak and you feel like you can't walk or move, and your hand is like, and you trying to figure out what's wrong with it. Peripheral artery disease. That's all over them. So that's all over the place. That's all over your body. So let me see what's in here. See, I'm already 30 minutes in. No, I was talking about them emails. Watch them emails, okay? Don't send it if it sounds offensive. If it sounds offensive, don't send it, okay? Read it again. Read it 2, 3 times if you feel like something sounds offensive, or just don't send it at all, okay? So just watch those emails. And you guys are sending me a lot of emails. None of them are disrespectful. Everybody's, kind. So you guys keep on doing that, and I'll keep trying to find something that interests you guys, and make sure that we keep talking about stuff that you guys want to hear. Remember those words we talked about, that he pat and that he mat. That's on the test. Be careful. Although it could be on the test. The brachytherapy, radiation. Be careful of that. Some of the stuff that I'm giving you guys, if you don't catch it, just kind of play it back. And we'll kind of get together, because when I start going over that ICD-10 book, I'm just going to run through. You guys have to go through the sessions to get some of the stuff in more of a detail, which is no big deal, because even if you have something that you want me to say or you want me to talk about, we'll go ahead and talk about it. The IBD, a young lady and I were talking about that earlier, so that's why I brought up the IBD and the IBS. Some people are afraid. They don't know which one is which, the IBD or the IBS. And anybody can get, the IBS. Be precarious of the IBD. It's a disease, like, a friend of mine, has a couple of complications. And even though when you say you have complications with your body or XYZ, and sometimes you don't want people to know what's going on with you, oh, I have such and such and such a, but see, somebody like me, something is causing that. See, I would be like, something is causing that. Maybe they don't want you to know. They want you, that's their business. But if you have this, something caused you to get that. You remember that word, metastasize? It doesn't have to necessarily mean cancer, or a tumor has metastasized into cancer, or a tumor or XYZ have metastasized into a bigger space. It could be you got this because something's going on with that. You know what I'm saying? So, you don't want to get too much in people's business or anything like that, but you want to make sure that, if they do ask you, you want to advise them the correct way. You want to send them to, hey, I had to go, see your provider about stuff like that. We're just coders. We only code what we see. And one of the things I want y'all to do is make sure you get your index cards, because trying to master the coding is so hard. I told y'all, you have to be literally physician yourself. That's why I said go on YouTube, have your computer in front of you, have your phone, have whatever in front of you, because while you're studying, you're going to need to look at the computer, because you're not going to remember everything. There's no way. I don't even remember half of nothing. I don't even know. I look on the computer and remember these things. You have to remember these things. And some of you guys who are at work, I'm telling you, there's a way that you can study, while you're at work. Nobody knows. Just put your headphones on and start listening to these things and programming yourself. Because when you guys are taking that coding exam, you want to feel comfortable taking it. You want to breeze through these. You want to feel comfortable taking it. AAPC is pretty good. Their AAPC book, ICD-10 CM, has so much nice illustrations in there. You guys are gonna love that book. I like the AMA too, but I think the AAPC book is more beneficial. And I think they got a sale on now, maybe 20 or 30% off or something like that. But that's what I would do. Also, don't forget to go on thrift books. You can get some of those books on thriftbooks.com for $5, $4, just to give you, insight if you want to. I don't know how old they are. Those books are very old, but just to, kind of play around with them. But, you can eliminate that by just getting this book. Okay, I got it upside down. Okay, let's put it right. Okay, medical billing and coding Q&A. Okay, study guide. In this book, there's so many things in here that you need. Okay, NEC, NOS. I'm not telling you what they are, because you guys don't buy the book and find out yourself. Okay, MAC. Oh my God, watch MAC. There's 2 MACs. MAC, Medicare Administrative Contractor. MAC, monitored anesthesia care. That's on the test. I'm telling you right now. Be precarious of that. And see, that's why I need you to get the book, because you never know what's going to be on the test. Okay? So if you guys want to continue on with E&M next week, we'll continue on E&M next week. I'll go into more of a detail of it. If you guys want me to do that. That's pretty much all I have for you today. But we're gonna close with just make sure you guys have that motivation and keep those people who are not for you away from you. Okay, set a time for yourself to do what you need to do. You don't have to sit there and study all day. 1 hour is good. Look at your notes. Some of my achievers, look at your notes. Look at your notes. When you guys get ready for those entrance exams, especially when you're going for a hospital, they got entrance exams for some of those positions. They have some billing questions on there, registration questions. What's HMO, what's PPO, different things like that. POS, that's to combine PPO and the HMO. So just be careful of that. I haven't talked about much billing. Just a couple of insights on the coding, but the billing is just as important. Those of you guys who are just going for medical insurance billing, they're going to give you a test on that. They ask you, what's practice management, different things like that. What is an adjustment? What does adjustment start off with? C this, C197, different things like that. So be precarious of those things, because you will be tested on that. Most hospitals give you those little tests just to see if what you're talking about, if you know a little bit about medical insurance billing. So just be precarious of that. What is commercial, third party payers and stuff like that. Self pay, and when do you bill a patient? Do you ever bill a Medicaid patient? Stuff like that. What is a statement? When does the statements and things like that go out? So yes, medical insurance billing. You guys do have to remember some of that stuff, because they will give you a test. You want to be prepared for that. So just kind of breeze through that VLOOKUP and just practice on it. You could test yourself. They have so much stuff on YouTube. It's like you can go over it over and over, and you will learn it. But next week, let me see. I got like 4 or 5 emails. Let me see this thing here. Yeah, this is what I'm doing. As I'm talking to you guys, I have people are emailing me, and they can ask me whatever they want to ask, but I can't really answer them, that quickly. But we'll figure that out. But anyway, we're gonna end this. I'm already 37 minutes in. I'm gonna do the 2 minutes extra. I'm just looking on here to see, what else was in here that I wanted to mention. Oh, I did want to mention in the coding, sometimes they may ask, what is on 1 centimeter, what is a mile, stuff like that. What is a millimeter? How do you say it? Milliliter? Write that down. Did I put that? I might have put that in the book. I might have not. But I think I did. But make sure you guys write that down. That's part of your study. Study that as well, because that may be on your exam. Okay, that may be on your exam. Don't forget your index cards. I live by these things right here. So get your stickies, get your highlighters, whatever you need to do what you need to do. Because the only way that you're going to retain and pass an exam is you have to study. You have to study for it. And don't give up. If you don't pass the first time, whatever test you take, I don't care where you're at, college, whatever, take it again. Take it again. Just keep taking it. And if you got goals that you want to do, just do them. They don't support you, don't tell them. Just keep it moving. Get yourself a plan and keep it moving. Okay? So don't forget, I got the Facebook for Sapphire Financial Training, LLBC. You guys can go on there and let me know anything. I took it off my phone because they keep sending me Twitter stuff every 2 minutes. So I just got it on the computer, but I'll check it every now and then. So that's pretty much it. Let me see what this is here. Nothing. A lot of that stuff we went over already, so I'm going to close this now. But if you guys do want me to go over that, okay, I'm getting texts for people for me to go over E&M again, but we go over that in the classroom, so that's why I don't want to do too much of that in the sessions. But I'll go over it again So we'll try to do, I'm going to try to do 20 minutes on it. If not, we'll go 30 minutes for next week on the A&M. But I'm going by CPC and I'm going by my study book. So that's what we're looking at. Okay, so you guys have a good rest of the night, and I'll see you next week. Bye.